Welcome to Season 4, Episode 21 of Workers Comp Unwrapped with your host, Aneeq and Angela, as our guest. Today we are talking about navigating OSHA compliance for medical practices in WC, where we are focusing on what OSHA is watching in WC clinics in 2026 and how to stay compliant. And, there's just this massive glaring irony in the medical field right now.
Oh, it's huge.
Right. Like the exact places that are dedicated to treating workplace injuries are quietly becoming some of the most dangerous places to actually work.
It really is a fascinating contradiction, honestly. You look at these facilities and they're built entirely around this concept of occupational safety, getting people back on their feet.
Yeah.
But then internally, they're harboring these incredible blind spots when it comes to their own daily operations. It's wild.
It totally points to the sheer hypocrisy of a clinic meticulously fixing, say, a factory worker's blown-out lumbar spine, right? While their own administrative staff is developing crippling repetitive strain injuries just from trying to lift heavy diagnostic equipment. It's honestly like going to a dentist who just has a mouthful of rotting teeth. You're trusting them with your recovery, but their own house is falling apart. So whether you are a clinic manager desperately trying to avoid bankruptcy-inducing regulatory fines, or you're just a curious learner who loves digging into some good old-fashioned bureaucratic drama, this deep dive is going to reveal how easily a seemingly safe healthcare environment turns into an absolute operational minefield.
And the landscape of that minefield is shifting dramatically as we move through 2026. The baseline reality we have to acknowledge is that healthcare environments are inherently high risk.
For sure.
We aren't just talking about someone slipping on a wet floor in the waiting room. We're dealing with complex physical therapy lifting, injections, complicated diagnostic procedures.
Active wound care, too.
Yes, active wound care. Biology is involved, which fundamentally raises the stakes.
Right, biology is always messy. So let's get into the specifics of that. I'm looking at clinics today, and they seem so modern and sterile. It's hard for me to see what a federal inspector actually writes a ticket for in 2026. What are they finding that the average patient or even a clinic manager can't see?
Well, they're heavily targeting three main areas, and the first two probably won't shock you, but the third one usually catches management completely off guard. First, there's infection control.
Right.
That means aggressive scrutiny on bloodborne pathogens, exposure control plans, and proper sharps disposal. Second is ergonomic safety. So we're talking about staff physically assisting patients with limited mobility or moving heavy rehab equipment.
And even the repetitive admin tasks I mentioned earlier, right?
Exactly, yes. But then there's the third area, the sharp rise in workplace violence prevention.
Okay, let's unpack this, because I'm tracking with you on the infection control and the heavy lifting. That makes intuitive sense for anyone working in a medical setting. But you mentioned this third point catches people off guard. What's the blind spot there?
What's fascinating here is how the very definition of workplace safety has evolved over the last decade. 10 years ago, safety in a clinic mostly meant making sure the fire exits weren't blocked by boxes of copy paper.
Yeah, or making sure the MRI machine didn't electrocute anyone.
Right, exactly.
Yeah.
It was almost entirely focused on physical environmental hazards. Now OSHA has expanded its enforcement to encompass behavioral risks. And the reason this matters, the big why behind OSHA's shift, is that clinics are so hyper-focused on patient care that they create a massive psychological blind spot for their own staff's well-being. The patient is the absolute priority, which inadvertently makes the employee an afterthought.
I hear that, but I need to push back a little on the violence aspect. Wait, we're talking about a physical therapy or rehab clinic, not a rowdy bar brawl at 2 a.m. Are we really saying nurses and admin staff are in that much physical danger from patients doing stretches and getting checkups?
It's a fair question, but you really have to look at the unique psychology of a workers' compensation patient. This isn't someone just coming in for an annual physical.
Right.
You're dealing with people who are often in chronic severe pain. They might be facing the permanent loss of their livelihood or, their identity as a provider for their family.
Oh, wow. Yeah.
On top of that, they're navigating this highly adversarial insurance system. They're dealing with delayed claim approvals, lost wages, and experiencing profound emotional stress.
That makes a lot of sense. They're already at their breaking point before they even walk through the glass doors.
Exactly. Picture a patient in that heightened state. They walk up to the front desk and an admin worker tells them their physical therapy sessions were just cut off by an insurance adjuster.
Oof. Yeah. Or maybe they're forced to wait 2 hours in a crowded lobby because a doctor is running behind.
Right. That intense emotional stress frequently boils over into aggressive, unpredictable behavior. It's a pressure cooker, and the front desk is usually the release valve.
Wow.
So OSHA expects clinics to recognize this specific behavioral risk and proactively implement workplace violence prevention measures.
Like de-escalation training and physical barriers.
Exactly, rather than just reacting after a receptionist is physically threatened or assaulted.
When you frame it like that, the high-stress environment of a workers' comp case really is a pressure cooker. So preventing these hazards, whether it's an aggressive patient losing their temper or an overflowing sharps container, is one side of the coin. But if a clinic actually manages to de-escalate that angry patient and they lift heavy equipment safely, OSHA still might penalize them if they didn't write it down, right?
Oh, absolutely. That is the ultimate trap of regulatory compliance. You can have the safest, most harmonious clinic in the world, but if your documentation is incomplete or outdated, you are completely exposed.
Because in OSHA's eyes, doing the right thing means absolutely nothing if you can't prove it on paper.
Precisely. Missing training records, non-existent exposure logs, delayed incident reports, these are the things that spell doom during a routine inspection.
Here's where it gets really interesting. Because it extends way beyond just signing a piece of paper after a safety video. It's the whole, if a tree falls in the forest and no one writes it down, it didn't fall.
Right.
We're talking about the hazard communication standards, which apply to the very materials clinics use every single day.
Yes. Under hazard communication standards, OSHA requires that anytime employees are exposed to potentially hazardous substances, there must be proper labeling and safety data sheets readily accessible.
And we aren't just talking about experimental medical chemicals or highly toxic chemo drugs here.
No. We're talking about routine operational materials. Think industrial cleaning chemicals, heavy-duty disinfectants used to wipe down therapy tables between patients, and even certain topical medications.
Which is where the bureaucratic absurdity reaches its absolute peak. You could have a highly trained, board-certified medical doctor, someone who performs incredibly complex, life-saving spinal surgeries, potentially getting financially penalized over an unlabeled bottle of Windex sitting in the clinic's janitor's closet. Because technically, according to the letter of the law, that is a chemical hazard without a safety data sheet. It sounds like a joke, but those fines are devastatingly real.
This raises an important question about operational accountability, though. Why does a federal safety inspector care about the Windex?
Right. Why do they?
It's not because they're being petty. It's because that unlabeled bottle proves a systemic failure. Written systems and strict documentation ensure consistency across the entire organization.
Okay.
Compliance failures usually happen operationally, not intentionally. A clinic doesn't wake up and decide to expose its staff to harm.
No, of course not.
But when you have high turnover or a chaotic Monday morning where 3 people call out sick, standard procedures get skipped.
So the Windex gets poured into an unmarked spray bottle by a rushing assistant.
Precisely. And maybe the new hire doesn't get their bloodborne pathogen briefing because the manager was too busy covering the front desk.
Sure.
The unlabeled bottle is a symptom of a much larger disease. Documentation creates a chain of accountability that forces the operation to slow down, verify safety, and ensure that basic protocols survive the chaos of a busy workday.
That systemic failure leads us perfectly into a massive misconception in the industry, which we can call the small guy myth. I can imagine a lot of listeners who run smaller practices thinking, OSHA doesn't care about us.
Oh, I hear that all the time.
Right. Like maybe they have 2 doctors, a couple of therapists, and 5 support staff. They think they're flying way under the radar going, oh, they're only going after the massive hospital networks. We're just too small to get audited.
That is perhaps the most dangerous assumption a clinic manager can make today. Smaller practices mistakenly believe their size grants them immunity from enforcement. In reality, they're actually far more vulnerable to catastrophic outcomes. Large hospital systems have entire departments dedicated to compliance, risk management, and legal defense. They have lawyers on retainer. A small clinic does not.
It's like upgrading your computer's processor to handle more software, but keeping a 10-year-old cooling fan. The faster you scale your patient load and increase your revenue, the faster your outdated compliance systems will overheat and crash the whole operation.
That's a perfect way to look at it. When a small practice grows, adding more patients, hiring a few more therapists, that growth happens without underlying compliance systems.
Right.
They scale their revenue, but they don't scale their safety protocols. That creates rapid, massive gaps in compliance. And when an OSHA inspector eventually spots those gaps, the fines aren't scaled down just because you're a small business. They can cripple a practice overnight.
So if the documentation trap is set and the operational foundation is weak, who actually calls the inspector? I mean, it's not just a random lottery of audits, right?
Literally.
Someone has to pick up the phone. And this leads us to the most uncomfortable truth of this whole deep dive. The call usually comes from inside the house.
We call it the whistleblower web. By far, the major catalyst for an OSHA inspection is an employee complaint, followed closely by the delayed reporting of injuries or exposures. Yeah, it's rarely a random sweep of a medical office building. It's usually someone working right next to you who feels their safety concerns are being chronically ignored by management.
Which makes total sense when you put yourself in their shoes. If I'm a physical therapy assistant and I've asked management 3 times to fix a malfunctioning hydraulic lift assist device and I keep getting ignored while my back is screaming in pain, well, my next call isn't to HR, it's to the federal government.
Exactly.
And OSHA strictly protects those employees from retaliation, right?
Absolutely. The whistleblower protections are ironclad. If an employee reports a safety violation and the clinic subsequently cuts their hours, demotes them, moves them to an undesirable shift, or fires them, that clinic has just turned a standard safety citation into a massive federal retaliation lawsuit.
Ouch.
The financial penalties multiply exponentially. This is why having a proactive internal reporting culture is vital. You want your employees complaining to you, feeling heard by you, and seeing action from you, rather than taking their grievances outside the organization.
Okay, so we've outlined the threats. We know the risks of the high-stress environment, we know the documentation traps, and we know disgruntled employees trigger the audits. How do we actively prevent this?
Right.
We need to focus on what to actually do about it. What are the specific things to try that don't just sound like generic corporate speak? How does a busy manager future-proof their practice?
It really comes down to implementing specific, highly actionable micro-habits rather than trying to overhaul everything in one day. Let's break down 4 things to try immediately. First, regarding safety policies, don't just have a dusty binder on a shelf.
Yeah, nobody reads those.
Exactly. Try implementing a policy of the month during your regular staff meetings. Take 5 minutes to review just one protocol like blood cleanup so it stays fresh in everyone's mind.
Instead of a 4-hour boring seminar once a year, just drip feed it. I like that. What about the documentation trap?
For training documentation, try the 2-signature rule. Don't just have the employee sign a paper saying they watched a video.
Okay, what's the second signature?
Have the supervisor sign it too, attesting that they watched the employee physically demonstrate the safe lifting technique or the proper use of PPE. That completely shuts down any OSHA doubt about the validity of the training.
That's a great mechanical fix. What's the third thing to try?
Internal audits. But don't make it a massive week-long event. Clinic managers should try a 5-minute Monday floor walk. Spend exactly 5 minutes every Monday morning walking the clinic with fresh eyes.
Just 5 minutes.
Just 5 minutes. You're looking specifically for 3 things: unlabeled bottles, blocked exits, and frayed cords on medical devices. That 5-minute habit alone prevents a massive percentage of standard citations.
And the fourth?
Fostering a culture where leadership actually takes the hit. If a doctor or the clinic owner violates a safety rule, say walking into a designated sterile area without proper PPE, they need to be corrected openly, and they need to accept that correction gracefully in front of the staff.
That's tough for some egos.
It is, but when the lowest paid admin worker sees that the highest paid surgeon is held to the exact same safety standard, it transforms the entire culture of the clinic.
Let's be brutally honest for a second, though. I'm playing devil's advocate here. These actionable steps, even the micro habits, still take time.
They do.
A 5-minute walk, 2 signatures, reviewing policies. Is the juice really worth the squeeze for a small, overwhelmed clinic? I mean, they're trying to heal patients, battle insurance companies, and just keep the lights on. Stopping the flow of the day to audit the janitor's closet feels like a drain on resources.
If we connect this to the bigger picture, the math overwhelmingly favors being proactive. Think about the alternative, reactive compliance.
Right.
Waiting for an employee complaint to trigger a full-blown OSHA invasion. When that happens, inspectors show up unannounced. They physically pull your staff off the floor for private interviews, completely halting patient care.
Which costs a fortune.
Exactly. They scour years of your injury logs. They shut down pieces of equipment. The sheer disruption to your daily operations, plus the legal fees to defend yourself, the massive fines, and the permanent hit to your reputation is vastly more expensive than dedicating 5 minutes a week to a floor walk. Reactive compliance will bankrupt a small clinic. Proactive prevention protects the bottom line.
It's the ultimate pay me now or pay me later scenario. You either pay with 5 minutes of your time on a Monday, or you pay with $50,000 and a legal nightmare next year.
Yep.
And there's the added reality that if you ignore it, your staff is actually going to get hurt. We also have to look at where this is all heading. The future of enforcement isn't just an inspector walking around with a clipboard anymore.
Not at all. OSHA enforcement is rapidly becoming data-driven and operationally focused. In 2026, regulators don't just want to see your paperwork, they want to see active daily integration of safety. They're using industry-wide injury data patterns and predictive modeling to figure out exactly which types of clinics are most likely to have violations. They want proof that safety is a living, breathing part of your clinic's daily workflow, not just a static policy you printed off the internet.
So what does this all mean for you? If you're listening to this, the core aha moments to take away from this deep dive are clear.
Right.
First, the irony has to end. Workers' comp clinics must treat their own staff's safety with the exact same rigor and dedication that they apply to the injured patients they treat.
Absolutely.
Second, documentation is your only armor. If you didn't write it down, date it, and sign it, the government assumes it simply didn't happen. And third, your unhurt employees are OSHA's best informants.
So true.
Taking those actionable steps, the 5-minute floor walks, the 2-signature rule, isn't just about satisfying a faceless government agency. It's about protecting your operational stability and keeping the people who work for you safe.
That's a perfect synthesis. The medical practices that thrive in this new regulatory environment will be the ones that view compliance not as an annoying burden, but as a structural advantage that keeps their team healthy, reduces turnover, and ultimately keeps their doors open.
It really requires a fundamental shift in mindset. But before we wrap up today, I want to leave you with a brand new, slightly terrifying thought that really builds on this data-driven future of enforcement we just touched on.
Oh boy.
With OSHA becoming increasingly sophisticated and hungry for metrics, how long until we see wearable tech integrated directly into clinic scrubs?
Oh, that's an interesting thought.
Right. Imagine a near future where smart clothing monitors a nurse's repetitive lifting strain in real time. Like if they use poor body mechanics to lift a 200-pound patient, the scrubs instantly beam that biometric data to a centralized enforcement dashboard. That dashboard then issues an automatic ergonomic citation to the clinic before a physical injury even has a chance to happen. It sounds like science fiction, but with the way behavioral and ergonomic risks are being aggressively targeted right now, the unsafe safety clinic might soon be monitored down to the very posture of its staff.
It is a wild concept to ponder, but given the rapid trajectory of occupational health technology and regulatory oversight, it might be more closer than any of us think. Thank you for exploring this with me today. It's been an incredibly revealing look at where the industry is heading.
Absolutely. It's been a great conversation with a lot of practical takeaways. Thank you for joining us, and thank you all for listening. We hope this deep dive helps you navigate the complex and sometimes totally absurd world of safety compliance. Take care and stay safe out there. Thanks for listening to Workers Comp Unwrapped. If you found value in today's episode, subscribe and share with fellow doctors. Stay informed and keep making a difference in your patients' care.